In this video, we're going to talk about the things that you should expect in the fourth trimester of pregnancy. The fourth trimester starts from immediately after delivery of your baby, which you can even call the first month of your postpartum cure. And there are a lot of things that you should prepare your mind in this before you enter, because a lot of women get disappointed because not just that they are disappointed, some think or some thoughts that once the pregnancy ends, the pains that they experience, the discomfort, that everything will subside immediately they put to bed. But most women get disappointed after this. So what actually happens in this? The first one is I'm going to talk about what we call lochia. Lochia is the bloodish discharge that you get after giving birth to your baby, and this discharge lasts for some days, and as it lasts, the color changes from red to dark brown to pink to brownish until it stops coming out. So some women think that this is their menstrual cycle. No, it is lochia. Lochia is just the fluid that comes out from your uterus after delivery, and that's why once a woman puts to bed, she's required to put pad for some days and it will go off. Then this lochia, it is normal, except when your own becomes profuse, comes out with clots, or is no longer changing color, the blood remains reddish after 1 or 2 weeks. Then you can go to your midwife or your gynecologist so that they will check it to know if that is actually postpartum hemorrhage. The second thing is the pain of attaching your baby to the breast. Yes, I need to be frank with you. The first time you put your baby to breast, which we encourage to be an hour immediately after delivery, that first time you attach your baby to breast, it is very painful. In case if you're a first time mom, you just bear this in mind. Even for second time mom, immediately you try to attach the baby to your breast, the breast becomes painful for you. It is painful, yes. Then the third thing that you should expect in the fourth trimester of pregnancy is that you will have to deal with sleepless nights, because that is when you are trying to establish breastfeeding, and your baby also will like to feed on demand. So, and on this demand means that the baby can breastfeed or feed on formula, depending on what you are feeding your baby with, within 2 or 3 times in 30 minutes. So you should prepare your mind to this. Then another one is, some people think that immediately after delivery they will not have the freedom to sleep on any kind of position that they want. But a lot of women get disappointed because you cannot sleep on your face. Reason is sometimes your breast gets engorged in this first trimester and it will be so painful, and sometimes it may not be the whole breast, it may be just the nipple, and it will be so painful that you cannot even assume that comfortable position that you've been looking forward to. You can assume other position, but because of breastfeeding and also because of the painful breast, it may be difficult at this early time of your postpartum. Then another thing that you experience
is difficulty in passing stool or urine at that initial point. A lot of women are faced with this and they are not even prepared towards that, especially those that receive episiotomy. They'll be so fearful on how to pass their first stool. So it's one difficulty that you should prepare your mind on. But I'm going to do a video on how to make this stage easy for us. So I'm going to prepare a video and post on that. Then aside that one, another thing that you also feel is when it comes to laughing. Maybe you have some visitors that would like to make you laugh, you want to cough, you want to sneeze. It's always difficult at this initial stage of your postpartum. Another thing you'll be faced with is
that you'll be faced with taking warm water. In case if you are taking cold water initially before you deliver, just this first month after delivery, it is advised that you take warm water. I do not say hot water, you take warm water. Then aside that, you can also experience waist pain because you may not be able to do other things that you used to do in the house, like bending down, sweeping the house and all this. You can do it if you don't have other options, but sometimes it predisposes these women to severe waist pain. So you may still feel waist pain, you may still feel dizzy, you may still feel weak immediately after delivery. So this is the major thing that you are to face in this fourth trimester. So that if this is the first time you are seeing my face, my name's Amara. I'm a registered nurse midwife that share about maternal and health child needs in this channel. Thank you for stopping by, and see you in our next video. You can watch any of these videos that I've done before, when I got pregnant, and other videos that I've done in my channel. And don't forget to subscribe, click the notification bell so that you don't miss out when I post a new video. See you next time. Bye.